Here's a common thing in the emergency department that I think AI is going to solve for us, and it's going to be good for everyone. It's incidentalomas. Happens all the time. Sometimes we miss those. Sometimes we don't mention them to patients. And a lot of the time it probably doesn't cause an issue, but sometimes it can. And here's an example. Let's say I'm hit by a truck right now. I have 7 rib fractures. I'm in the ICU. I'm discharged home, and on my pan scan with contrast, they find, hey, you have a little lung nodule. It's about 1 centimeter big. You should get another CT in 6 to 12 months to make sure it's not progressing. But no one mentions that because I was hit by a truck. And if I was hit by a truck, the thing that they care about is hemothorax, blood where it doesn't belong, flailed chest, what's my oxygen like, right? Like, no one is paying attention to the 1 centimeter nodule that deserves follow-up. But that's not the point there. And since we're in this Swiss cheese model of a lot of academic medicine, like they come into the ER and there's 2 residents and an attending, there's a trauma intern, a trauma senior, and a trauma PGY 9 or whatever it is, and a trauma attending that are all zoned in to, rightfully so, their area, right? Because if I am on a morphine drip or a fent drip or I get pain dose ketamine, like not really the time to bring up my little lung nodule, but the standard practice of when that comes up varies, right? Some places have nurses or educators or NPs and PAs that review all of these. But if there isn't a designated person, which a lot of places can't afford to do, that can go by the wayside. And in less extreme examples, this can come up, right? Like I saw a video recently of someone saying like, hey, your ultrasound is normal. And from the ER perspective, like a transvaginal ultrasound could be normal if there's no torsion, there's adequate flow, there isn't a giant cyst, there's no ectopic pregnancy, there's no free fluid. Those are the emergent things that we think about. But like the 1.5 centimeter cyst in a young person with a uterus and ovaries, could be simple or it could be complex. So even though if they have a complex cyst that needs follow-up, that could be a cancer, from the emergency department perspective, we're zoned into our area. And it's a fault of ours and it's a fault of medical system at large. But I'm optimistic that there's going to be AI systems or automated systems that will recognize things as incidentalomas and automatically incorporate that into the chart with some kind of follow-up. Because those are missed and sometimes patients are harmed, and that is bad.